Hello Sages! Welcome to Sage Advice for Daily Life, held every Monday and Friday live on Facebook. This is a weekly wellness series created just for you. I'm Dr. Jen Martin, a psychologist in Gainesville, Florida. Today we'll be talking about a variety of different ways to help improve your sleep habits during COVID. I noticed a lot of my clients in the last couple of weeks were experiencing problems in this area, and so I thought it would be a really helpful and timely video. Our bodies respond to stress in a variety of ways, but most commonly we are all impacted when we notice stress impacts our sleep habits, our eating habits, and even our weight. And we're all impacted differently. Some of you might have noticed that you had an inability falling asleep, maybe you're waking up more at night, or even having nightmares more often. Prior to the pandemic though, a third of Americans were reporting that they didn't get enough sleep. And this really is the most underrated health habit. Americans were saying first they were not getting enough sleep, and also they were having some insomnia, which meant that they were having a difficulty falling asleep or even staying asleep at night. For teenagers, they need about 8 to 10 hours of sleep a night, and for adults, about 7 to 9 hours of sleep a night. And when we experience sleep deprivation, we have problems with irritability, an increase in stress, and the health and mental health conditions that we experience actually get exacerbated. There have been different sleep studies that show that when we are impacted by a traumatic event, our sleep always gets impacted. And actually, the closer that you are to the traumatic event, the more sleep problems you're prone to have. So for example, if there was an earthquake or when there was 9/11, the closer you were to actually that event happening, the more impacted you would be. And so during COVID, we might be finding that health workers and that family members impacted by COVID are going to be maybe more prone to being impacted too. And sleep really does get impacted by our level of stress. We find that it's universal among different age groups, genders, types of stress, and culture that when we experience those problems, we have more sleep distress. And we know that stress affects our brain, our nervous system, our immune system, and our endocrine system too. And all of those things work together during stress to create a state of hyperarousal, tension, and just feeling on. And when we have that hyperarousal, it impacts us both physically in terms of our body, so feeling more muscle tension, having more cortisol in the body, and also it impacts us cognitively. We're more prone to having worries, racing thoughts, things like that. And when we get stuck in our mind, it means we're not then living in the moment, which makes it even harder to fall asleep. Also, recent articles have shown that during COVID, people are having more nightmares and more vivid dreams than they were having before. They were recognizing that when we have less daily stimuli and less novel stimuli that we're experiencing, that then we are more likely to have our subconscious mind draw on themes from our past. And so that's why you might be noticing an increase in more of those negative dreams or even in dreams in general. And the interesting thing is that actually REM sleep and dreams are going to help us with dealing with stressful emotions. So if you're finding that happening, it means that the body's trying to heal itself right now. A very good thing. There's a variety of different health habits that I want to share now that are going to help improve your sleep habits, and this is called sleep hygiene. When we think about our physical hygiene, there are a lot of things that we do to help our physical body to be clean. So these are things like washing our hands with soap, brushing our teeth, things like that. And these are habits, many habits that you do throughout every single day. And if we want to help ourselves have very happy and healthy sleep hygiene, then we want to make sure we're incorporating as many of these as possible as well. For most of us, it takes about 2 weeks for our sleep cycle to reset. And so if you notice after a couple of days you don't notice a dramatic change, that's okay. Keep trying. It'll get there. The first thing is we want to make sure that we improve our sleep environment. We want our bedrooms to feel like a sanctuary. So this usually means tidying up. Try to keep the clutter to a minimum and make it a place that just feels peaceful and comfortable. Also, we want to have a comfortable mattress. If you wake up feeling tense or stiff, that might be because your mattress is more than 10 years old and too old. Also, make sure that you don't have light in the bedroom. I always find it helpful to keep a towel over the top of an alarm clock so that it keeps the light really low, and I like having blackout curtains as well. Keeping noise low as well will be helpful too. So if you have any kind of animal or pet that creates noise, maybe keeping them outside or having a sound machine can feel helpful. And also keeping the temperature cool. They say 67 degrees or lower is actually the ideal temperature for sleep. And I find for myself, that's a little chilly. So being a Floridian and a Hawaiian, so anything lower than 70 degrees for me feels good enough. Also make sure you only use your bed for sleep and for intimacy. We don't want your body to start associating your bed with other things like studying, like screen time, and so we want to keep those things to a minimum. Earlier in the day, you also want to make sure that you keep your body active. This means cutting out all naps or keeping them at the most to 20 minutes. And we want to make sure that we are physically active during the day sometime as well. This could be a walk around the block, just anything that burns some of that extra energy. Also, if you find that you're experiencing some of those nightmares, it can feel helpful to actually handwrite out a new ending to the nightmare. This helps our body to realize and actually implants into our memory, hey, there's another option here. I don't have to have this scary thing happen at night. And just make sure you rehearse that over right before bed too. Also, make sure you create a schedule. You want to make sure that you're waking up and going to bed around the same time every day, within about an hour or so of normal. And you want to make sure that this is happening even on the weekends. I know that can be difficult, but it's such a glorious feeling to wake up without an alarm clock, so I hope that for you too. Now, 2 to 3 hours before bed, this is really when we need to start changing things. 2 to 3 hours before bed, we want to make sure that we are not eating any kind of large meal or any kind of big spicy meal that might give you some kind of indigestion or pain or discomfort. We also want to reduce our alcohol use and caffeine use and make sure we're not exercising or revving up the body again right before sleep. At bedtime, and actually 30 to 45 minutes before bedtime, we want to start creating a bedtime routine. This is when we're really teaching the body to start to slow down. We're going to dim the lights, we might read a fun book, we're going to cut out screen time, we might have a warm bath, herbal tea, things like that. And also, many people find that doing a relaxation or breathing exercise can be incredibly helpful. So 2 that are my favorite are, I would look up Yoga Nidra and a body scan. There's no actual yoga involved in that. This is all just a focused meditative and breathing practice that helps you to understand and notice sensations in the body in a very peaceful, relaxing way. So check those out. Also, you might practice counting your breath. So this would be actually breathing in to the count of 1, exhaling, numbering that 2, inhale 3, exhale 4, all the way to the count of 10. Once you get to 10, you just start back over at 1. Eventually you'll find that you'll lose track of the number. No worries, just pick it back up where you left off. And the whole point in just cycling through the number 1 through 10 over and over is because we're not trying to get anywhere. It's just an anchor, something we're having our mind attached to make sure that that's our focus rather than the worries or the fears that we're having that's keeping us awake. And you might even visualize yourself asleep as well. So really picture yourself in very sweet, peaceful slumber as well. If you find that you're prone to waking up in the night, try not to check your phone if possible, and certainly don't actually scroll through your phone when you're in bed. If you feel like it's been longer than about 20 minutes though and you're still awake, you can go ahead and get up, leave the room, get out of bed, keep the lights really dim, and see if you can do something that feels pretty understimulating, like maybe reading a book you've read before. Now, once you do finally wake up at night, try to get near some sunshine in the morning. This helps keep our circadian rhythms going because the body associates being awake with sunshine, so we want to get that in there too. And lastly, always remember to be very gentle and kind to yourself. There's so much transition and change happening right now, and we want to really celebrate and highlight the fact that you are doing the very best you can. We all are. So go ahead and make a comment about one different sleep hygiene technique that you want to start practicing tonight, and I'll post in a little bit a sleep bingo. Feel free to share that with your friends, see who wins. It's a fun way to see and make sure you're incorporating as many of those sleep techniques as possible to really boost your health. Thank you for joining me today, Sages. Next time we'll be talking about specific ways to increase productivity, motivation, and concentration during COVID. See you later.